So, radiological tests or scan form a important part of oncological diagnosis as well as follow-up. So, why do we do these radiology or scans? Is that whatever cancer is there or the tumor, if we are suspecting in an area, we can see only a part of it from our naked eye. Whatever is outside or outside the protruding outside, we'll be able to see. But sometimes what happens is that the cancer may be going further deep, or it may involve some minute structures which we cannot see from the naked eye. So that is why we take use of help of these scans to come at the proper staging of the disease. So the most commonly done scans in oncology, it includes an ultrasound, CT scans, MRI scans, PET CTs, and in some cases the thyroid scans. So ultrasound is a very commonly done scan. The advantage is that it is a very non-invasive and it is very rapid, and there is no much preparation or anything that is required. We will be able to get the results very very fast. But the limitation is that compared to other scans such as CT and MRI, the clarity or the resolution is not that great, because we'll be able to see some lesion, but exactly quantify what is the size, which all structures it is involving, it is a little bit difficult. Similarly, if the tumor is located very deep, again ultrasound is not going to be much helpful. So the next two scans, CT scan and MRI scans, are the most commonly done scans. So CT scan can be done in almost all subset of cancers, be it head and neck cancers, be it abdominal cancers, pancreatic cancers, or bladder cancer. In most of the cancers, CT scan can be done. So only in few subset where more soft tissue is there or muscles are there, such as the tongue, could be the pelvis, the rectum, or structures such as the brain, or extremities such as shoulder, bone, knee, joint, etc. MRI is more useful because it gives a better soft tissue or a muscle soft tissue delineation in MRI is much better than CT. So in these conditions, MRI is preferred. But generally, most of the other conditions, CT scan is more than sufficient. So in both, be it MRI or CT, generally a contrast is given. So what basically contrast does it when you inject it into the body? So it goes throughout the body and also into the areas of tumor, so that it is seen as intense lesion, or it is seen as a very bright lesion on the scans we take, so that we are able to differentiate which is a normal structure and which is the abnormal or the cancerous growth. But to give contrast again, it has effects on our renal or kidney. So the kidney functions has to be tested, and only if it is normal, it is given. So, but apart from all of these four, MRI, CT, and PET CT are the most commonly done scans. Typically, for ultrasound, you don't need any much preparation. But for CT, MRI, and PET CT, ideally the patient should be in fasting at least for 4 to 5 hours. All of these tests are very very safe, and they do not cause much side effects or any discomfort. Only one point to remember is that whenever you're getting a contrast study, your renal parameters will be checked, and you have to have good amount of water or fluid after the procedure.